What if the thing you've been calling dry skin or just getting older was actually your immune system quietly attacking you from the inside, and had been for years? Right now, I want you to do something. Go to the nearest mirror. Or just hold up your phone camera. Look at your face. Really look at it. Are the corners of your eyes a little red? Are your lips constantly cracked no matter how much you drink? Is the skin around your mouth drier than everywhere else, and has been for so long you stopped noticing? These are not random. These are not cosmetic. And they are not just aging. Sjogren syndrome is one of the most underdiagnosed autoimmune diseases in the world. It affects an estimated 4 million Americans, and up to 50% of them don't know they have it. Because the early signs don't look like a disease. They look like your face. On a normal day. And that's exactly why doctors miss it. Today, we're going to walk through 5 specific facial signs that show up before most people ever get a diagnosis. 5 things you may have already noticed and dismissed. And by the end of this video, you're going to understand why these signs matter, and what to do about them. Before we go any further, if even one of these signs felt familiar, I want you to have the symptom map I built around this. It's a full visual guide showing exactly how Sjogren's moves through the face and body, plus a deep research PDF with every test, every phrase, and every warning sign mapped out in one place. This is not a freebie. But it's as close to one as I could make it. Link is in the description, or type symptom map and I'll send it directly to you. Sjogren's is a chronic autoimmune disease where your immune system attacks the glands that produce moisture, your tear glands, your salivary glands, and eventually glands throughout your entire body. The result? A systematic drying out. Not just of your eyes and mouth, but of your skin, your airways, your joints, and your organs. In serious cases, it can damage your kidneys, lungs, and nervous system. But here's what almost no one talks about. The earliest signs show up on your face. Often years before the internal damage begins. And if you know what to look for, you can catch this thing early, when treatment actually changes outcomes. Let's start with sign number 1. Sign number 1. Persistent eye redness, grittiness, or a film over your vision. You wake up and your eyes feel like you slept in sand. You blink a few times. Still gritty. You've had artificial tears on your nightstand for 2 years now. You've blamed it on screen time. Your allergist gave you antihistamines. Your eye doctor said your eyes look a little dry, and told you to use drops. You do. It helps for an hour. Then it's back. Eye doctors and general practitioners are trained to treat the symptom, not investigate the cause. Dry eyes are so common that the reflex answer is almost always screen time, allergies, aging, low humidity, contact lenses. And for most people, that's exactly what it is. But for Sjogren's patients, the cause is something entirely different. In Sjogren's syndrome, your immune system's white blood cells, specifically lymphocytes, infiltrate the lacrimal glands. These are the glands behind your upper eyelids responsible for producing the aqueous layer of your tear film. As the lymphocytes attack the tissue, gland cells are destroyed and replaced with scar tissue. Over time, the gland literally loses its ability to produce tears. This is called aqueous deficient dry eye, and it is fundamentally different from the environmental dry eye your eye doctor treats with drops. Artificial tears temporarily replace what the gland can no longer make. But they do nothing to stop the ongoing immune destruction happening behind your eyelids. Without intervention, the corneal surface, the clear front window of your eye, begins to break down. This shows up as tiny microscopic scratches that are invisible to you but visible under a slit lamp. If left untreated, those scratches deepen into corneal ulcerations. In severe Sjogren's, patients can develop vision changes, corneal scarring, and in rare cases, significant vision loss. This is not a cosmetic issue. This is an organ being slowly damaged because no one connected the dots. The tests to ask your doctor about: Sjögren's test, which measures tear production, less than 5 mm in 5 minutes, is significant. Rose Bengal or Lissaman green staining to check for corneal damage. An ANA panel. SSA and SSB antibody testing. And ESR and CRP as inflammation markers. Say this to your doctor: I've had persistent dry eyes that don't respond to artificial tears for over a year. I'd like to be tested for an autoimmune cause, specifically Sjogren's syndrome. Can we start with ANA and SSA, SSB antibody testing? Look at the white of your eyes right now. Is there chronic redness, not just today, but consistently? Does it feel gritty, scratchy, or like something is always in there? Type face signal in the comments if this one hit. Sign number TWO, cracked lip corners, persistent dry lips, or a tight feeling around the mouth. You always have lip balm nearby. Not because you want to, because without it, your lips crack within an hour. The corners of your mouth split regularly, especially in air conditioning or winter. You've been told it's a B vitamin deficiency. Or that you lick your lips too much. Or that you're just dehydrated. You drink more water. It doesn't help. Angular cheilitis, the medical term for cracking at the corners of the mouth, is extremely common and has many causes. Fungal infection, vitamin deficiencies, ill-fitting dentures, or just cold weather. Doctors reach for the obvious diagnosis. Lip balm gets prescribed. Vitamins get recommended. The visit ends. Here's what they're not checking: the minor salivary glands. You have hundreds of these tiny glands lining the inside of your lips and cheeks. In Sjogren's, the same immune attack targeting your tear glands is hitting these glands simultaneously. As saliva production drops, the oral environment becomes chronically dry and acidic. Saliva isn't just water, it contains antimicrobial proteins, enzymes, and protective factors that keep your mouth healthy. Without it, the lips crack, the corners split, and the tissue becomes vulnerable to secondary infections. But here's what makes this a crucial early warning sign: the minor salivary glands in your lower lip are accessible. A doctor can do a lip biopsy and directly observe immune cell infiltration that confirms Sjogren's with high specificity. Chronic salivary gland destruction leads to severe dry mouth. Without adequate saliva, teeth begin to decay at an accelerated rate. Sjogren's patients have dramatically higher rates of dental cavities, even in patients with excellent oral hygiene. The enamel erodes. Teeth fracture. Root cavities appear in unusual locations. Dentists see this and wonder why a patient who brushes twice a day is falling apart. Beyond dental damage, saliva loss also impairs swallowing, speaking, and taste perception. And chronically dry oral tissue has a higher susceptibility to persistent fungal overgrowth that keeps being treated without ever addressing the root cause. The tests to ask for: a minor salivary gland biopsy of the lower lip. This is the gold standard for Sjogren's diagnosis. Salivary flow rate measurement. SSA antibody panel. And parotid gland ultrasound. Say this to your doctor: my lips and the corners of my mouth have been chronically dry and cracking for years, and it doesn't respond to hydration or lip balm. I want to rule out Sjogren's syndrome. Can we discuss a minor salivary gland biopsy or SSA antibody testing? Press your lips together right now. Are they dry within minutes of applying balm? Are the corners of your mouth cracked or raw? Type DIYs in the comments if doctors have dismissed your symptoms without testing. This pattern matters. Sign number 3, swollen, puffy, or enlarged cheeks near the jaw, especially on both sides. You've noticed your face looks fuller than it used to, specifically along the jawline, just in front of your ears, and below your cheekbones. It's subtle. You thought you gained weight in your face. Your partner thought it too. But your weight hasn't changed. Sometimes it's worse than others. Occasionally one side is more swollen. You never connected it to anything. Parotid gland swelling is often chalked up to weight gain, mumps history, alcohol use, poor diet, or dental infections. Because it comes and goes, and because most people don't know what the parotid gland is or where it sits, it gets ignored. Dentists sometimes notice it. They rarely investigate. The parotid glands are the largest salivary glands in your body. They sit directly in front of and below each ear, wrapping around your jaw. In Sjogren's syndrome, immune-mediated inflammation causes these glands to swell, sometimes dramatically, sometimes subtly. When it appears on both sides, it is a red flag sign that something systemic is happening. This is not a dental issue. This is not weight. This is your immune system actively inflaming major glandular tissue that produces a third of your body's daily saliva. Persistent glandular inflammation leads to fibrosis, the replacement of functional gland tissue with scar tissue. Once that happens, salivary production in that gland is permanently reduced. There is also a critical long-term risk that most people never hear about. Sjogren's patients have a dramatically increased risk of developing non-Hodgkin's lymphoma compared to the general population, and the parotid gland is one of the primary sites where this can develop. Chronic glandular inflammation is a known precursor. This is the sign that escalates fastest if ignored. By now, If two or more of these signs feel familiar, you need to see the full pattern in one place. Type symptom map below right now. The map connects these early facial signs to what happens next in the body, so you understand exactly what you're looking at. Tests to ask for: parotid gland ultrasound. Changes in texture are a key Sjogren's marker. MRI of salivary glands in complex cases. ANA, SSA, and SSB antibodies. And parotid gland scintigraphy, which is a functional scan of gland activity. Say this to your doctor: I've noticed recurring puffiness along my jawline near my ears, sometimes on both sides. I want to rule out parotid gland involvement related to Sjogren's syndrome. Can we order a salivary gland ultrasound and SSA antibody panel? Look straight into the mirror and place your fingers just below each cheekbone, in front of your ears. Is there any fullness or swelling there, especially symmetrical? Type checked in the comments if you just looked. Sign number 4, dry, flaky, or abnormally sensitive skin on the face, especially around the nose and chin. Your facial skin feels perpetually parched. Moisturizer soaks in and disappears within minutes. The skin around your nose is constantly flaky, your foundation never sits right there. The skin near your chin gets irritated easily, reddens without obvious cause, and sometimes develops a rough texture. Dermatologists have tried multiple creams. You've been told it's rosacea, or seborrheic dermatitis, or sensitive skin. You accept it as just your skin. Facial dryness is one of the most overdiagnosed and underinvestigated cosmetic complaints in medicine. Dermatologists are focused on the skin itself, and when there are no obvious systemic symptoms presenting alongside it, the conversation stays superficial. Moisturizers get prescribed. Steroid creams. Gentle cleansers. The skin changes are treated as the problem, not as a signal. In Sjogren's syndrome, immune damage extends beyond the major salivary and lacrimal glands to affect exocrine glands throughout the skin. The skin has its own network of moisture-producing glands, and in autoimmune disease, these too become targets. The result is not ordinary dryness. It's a structural breakdown in the skin's ability to retain and produce moisture from within. Additionally, Sjogren's patients often have elevated inflammatory proteins that make skin hypersensitive and prone to flushing and irritation. A subset of Sjogren's patients also develop a reddish ring-shaped rash that most frequently appears on the face and is almost exclusively associated with SSA-positive autoimmune disease. Chronic skin inflammation driven by immune activity can progress to inflammation of the small blood vessels supplying the skin. This can show up as tiny reddish-purple spots, most commonly on the lower legs but sometimes appearing on the face. This is significant because it is a marker of systemic disease activity, meaning the immune process is no longer confined to glands. It has entered the bloodstream. Skin signs are often the earliest external evidence that Sjogren's is becoming systemic. Tests to ask for: ANA with pattern analysis. Anti-SSA antibodies, which are strongly associated with skin features. ESR and CRP. A skin biopsy if you have an unusual rash or reddish-purple spots. And complement levels, C3 and C4, which can drop in vascular inflammation. Say this to your doctor: I have persistent facial dryness and sensitivity that doesn't respond to moisturizers, and I've also noticed redness that doesn't fit a typical rosacea pattern. I'd like to explore whether this could be a cutaneous manifestation of an autoimmune condition like Sjogren's. Look closely at the skin around your nose and chin. Is it perpetually flaky, not just in winter, but year-round? Does it redden easily without an obvious trigger? Type face signal in the comments if this one describes you. Sign number 5, facial tingling, numbness, or an unexplained buzzing sensation, especially around the cheeks or lips. Sometimes your cheek feels slightly numb, like it's just woken up from a light sleep, but it never fully wakes up. Or there's an odd tingling sensation along your jawline, or at the edges of your lips. You've Googled it. You found anxiety, dental nerve damage, vitamin B12 deficiency, multiple sclerosis. You brought it up to a doctor once. They checked your B12. It was normal. They said not to worry. Facial sensory symptoms are notoriously difficult to pin down. Without an obvious lesion or abnormal neurological exam, they often get attributed to anxiety, hyperventilation, stress, or vitamin deficiencies. The possibility of an autoimmune mechanism affecting peripheral nerves is rarely considered unless the neurological symptoms are severe. This is the sign that most doctors completely miss, and it is the most serious one on this list. Sjogren syndrome is now recognized as a major cause of peripheral neuropathy, damage to the nerves outside the brain and spinal cord. In fact, neurological involvement occurs in up to 20% of Sjogren's patients, and in many cases, it appears before the classic dry eye and dry mouth symptoms are even recognized. The facial tingling and numbness you may be experiencing can be caused by immune-mediated inflammation affecting the trigeminal nerve, the large sensory nerve responsible for all sensation in your face. The immune system cells infiltrate the nerve tissue, strip the insulating layer from nerve fibers, and disrupt normal signal transmission. This is not anxiety. This is not stress. This is a nerve being actively damaged by an immune response. Untreated neurological Sjogren's can progress from sensory symptoms, tingling, numbness, to motor involvement, autonomic dysfunction, and in severe cases, central nervous system disease. CNS Sjogren's can present as cognitive difficulties, brain fog so severe patients struggle to function, and white matter lesions on MRI that are sometimes confused with early multiple sclerosis. When a Sjogren's patient reaches this stage without a diagnosis, they have usually spent years being told their symptoms are psychological. They've been sent to psychiatrists, told to reduce stress, given antidepressants. Meanwhile, a treatable autoimmune process has been progressing untouched. The facial tingling is often the moment where an informed patient can change everything, by insisting on the right investigation before the window for early intervention closes. If your face is showing the signs we just covered, especially any nerve-related symptoms, do not sit on this. Type symptom map right now before you scroll away. The map shows you the full progression, from these early facial signals to what happens in the body if it goes untreated, so you can see the whole picture in one place. Tests to ask for ANA and SSA antibodies, which are positive in the majority of neurological Sjogren's cases. Nerve conduction studies and EMG. An MRI of the brain with FLAIR sequences to check for white matter changes. And quantitative sensory testing for small fiber neuropathy. Say this to your doctor: I've been experiencing intermittent facial tingling and numbness around my cheeks and lips for several months. I've also had dry eyes and dry mouth. I'm concerned this could be trigeminal neuropathy in the context of Sjogren syndrome. I'd like a neurology referral and SSA antibody testing. Touch your cheeks right now. Your jaw. The corners of your lips. Is there any numbness, even subtle? Any tingling that comes and goes? Type DIYs in the comments if doctors have repeatedly dismissed your symptoms. This one matters more than people realize. Here's what I need you to understand before you close this video. The 5 signs we just walked through, the gritty eyes, the cracked lip corners, the swollen jaw, the stubborn facial dryness, the tingling and numbness, these are not random. They are not cosmetic. They are not aging. They are a pattern. And patterns have causes. Sjogren syndrome, when caught early, when facial signs are the primary complaint and the internal damage has not yet begun, is manageable. There are immunosuppressive treatments, moisture replacement therapies, and monitoring protocols that can protect your eyes, your teeth, your nerves, and your organs. But when it gets missed, when it gets dismissed as dry skin, stress, allergies, anxiety, the destruction continues silently. Glands scar. Nerves demyelinate. Organs become involved. And by the time the diagnosis happens, the question is no longer how do we prevent damage, it's how do we manage the damage that's already done. Your face showed you this pattern. That matters. Don't let anyone tell you it's nothing. Go to your doctor with the specific tests we discussed. Use the exact phrases. Ask for the blood work by name. If one doctor dismisses you, find another. You are entitled to an explanation for what your body is doing. And don't try to piece all of this together alone. Type symptom map in the comments right now and get the full breakdown. It shows you the complete progression of Sjogren's, from these early facial signals to what happens in the body if it goes untreated, so you can see the whole picture in one place. Type symptom map below. Do it now, before you scroll away. If this video helped you see something you've been missing, share it with someone who needs to hear this. Like it so more people find it. And subscribe if you want to keep understanding what your body is trying to tell you. Take care of your face. It's been trying to talk to you.